COVID-19 patients who have recovered and who have been isolated at some government hospitals are up in arms over huge bills they've been made to pay and rather settle before leaving the facilities. Well, this is despite a government assurance that anyone brought to a state facility for COVID-19 treatment will not pay. Dennis Otieno with more.
When Jane, not a real name, came back to the country from abroad in June this year, a quarantine facility was the last thing on her mind. She had tested positive for coronavirus. But after treatment at the Kenyatta University Teaching, Referral and Research Hospital, she finally recovered and tested negative and was due for release on the 24th of this month. To finalize her discharge, however, she was to pay this hefty bill of over 70,000 shillings.
Nimetesti negative, lakini nimenyimwa kutoka juu sijalipa pesa. Na mimi zinega sasa mimi kosi free. Sasa nitaambukizwa tena hapa.
She and a handful of others claim they are stuck here and don't understand why they are being charged for quarantine at a public facility. According to these shared documents, the hospital is charging 3,135 shillings daily per person for bed. Besides the accommodation, other charges emanate from pharmacy and laboratory testing. The stunned patients have to use this pay bill number to settle their dues.
Peana anaambiwa lete 41. Kama uno, you go back to the ward until you pay. And every day you stay here, tuchukua vitu zetu, pesa yetu, twende kwa gate. Twende kwa gate.
The patients are now wondering why they are being detained, despite government assurances that patients should not foot such bills unless stated otherwise.
I think the position still stands that the government does not expect those who receive care in its public health facilities for COVID-19 to pay for those costs. If there are reports that some public facilities are charging, it is something that the ministry will look into and establish what are the reasons. There could be some reasons that might justify that, but we will need to look into those cases and find out, are these isolated cases or is it a blanket situation where everybody who comes in to any public hospital like KU RRH is required to pay. I think that is something we shall take up.
Our calls to the hospital's Chief Executive Officer John Wekesa went unanswered. Citizen TV has however learnt that the charges could be as a result of non-COVID-19 tests for patients brought to the facility. Dennis Otieno, Citizen TV.